here with Brad. Usually I'd have Kristen on. Well, usually we've had one episode.
I am Kristen.
But I'm
The operation went well.
freshly home from an 8-day stay in the hospital. And
Was it only 8 days?
what day did you take me up there last Thursday? Now I'm confused.
It was the Thursday before last Thursday, wasn't it?
Yeah.
Yeah, because we missed that podcast, and then we missed last week's podcast.
Yeah, because I went in Thursday and I went home on a Friday.
That's the NT Paranormal podcast.
So 8 days, yeah.
Okay.
So I spent the first night at Hughley in Burleson.
You just want the shared to your...
Yeah.
Okay.
Yeah, I spent the first night in Hughley at Burleson. They put in a PICC line. It's hard to get a vein on me. So if you get frequent IVs, they'll do something called a PICC line. And they use a sono machine. They find a bigger vein in your arm, and they run a line all the way in through your heart. It's a central line.
That sounds terrifying, though. Yeah.
It doesn't hurt at all. They numb it, and it...
Like numb, 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 numb.
And they put a thing on your chest because they put a weight at the end of it, and it shows where the weight's sitting because it keeps it in the right flow in the vein. It's actually pretty interesting to watch.
So I helped you stream from your phone. Was that the last stream? Was just from in for? Oh no. We streamed from the hospital
Yeah.
right too once you got in or whatever. So
At about 2 a.m., they came in and told me that they were going to transport me to Harris downtown because they wanted me. My CT showed air in my arm and like little pockets, and they sent me downtown via ambulance. And instead of doing surgery there, they stuck me in traction for 5 days.
right, and that's what we were worried about going in. Like when we were first,
That was my nightmare. That was my specific nightmare.
Yeah, that's what we were talking about in front of the hospital. We were like, hey, it sucks that these hospitals won't talk to each other because I was asking you questions about how you like Hughley. And you're like, well, it'd be better.
Oh, yeah, and they couldn't get any of my imaging from Hughley to Harris. My mom actually offered to go by and get the disc with the imaging on it, and they refused her.
Did they refuse it because they said it was a HIPAA violation, or were they?
No, Harris just said, we won't use it. We're going to do all our own stuff.
And then they proceeded to not
do any imaging studies
right.
at Harris.
And I really like what you were telling me about the doctor. He's like, well, why'd they bring you here for surgery? Well, you don't want surgery.
Which I actually ended up really liking that doctor. I saw him again today. He pulled half my stitches, and I had a JP drain in my arm post-surgery. It's to keep fluid from accumulating. I actually ended up really liking the doctor. I think his point was, no matter what he saw on that, is he was a doctor that relied more on physical exam and how I was doing. I don't think he communicated that correctly.
So
his
his communication skills sucked, not his.
And he actually, once the second day rolled around, his bedside manner got a lot better. I don't know what was going on that first night of future. I mean, doctors and nurses are human.
Maybe he'd been drinking.
They have bad days. They get rushed. That floor I was on was full. They had 7 patients.
Oh yeah, because they stuck you in the geriatric wing. Right?
It wasn't geriatric. It's specifically the gastric diseases. So they do a lot of gastric cancers.
Okay.
But they also treat cellulitis, which is a really weird thing to put together.
It's a weird combo, yeah.
Yeah. But it was super busy. Like when I went out, because they made me walk every day, every room was full.
Yeah, I know when me and Mike went to visit you one day, we saw you trying to make a jailbreak in your pajamas. That was pretty intense.
I wanted out of there so bad. But my specific worry was, I told Brad before I went in, I said, if they put me in traction, dear God, don't leave me alone.
So I keep saying this wrong, not the CRPS part, but the compartment syndrome. So compartment syndrome was the key to this whole thing this time.
And that's what started all of this.
I didn't realize that if you get compartment syndrome, it puts you at higher risk for compartment syndrome, which is why you were at the hospital in the first damn place, because you'd gone to the doctor, and they're like, okay, it's broken. Then they sent you home. And then you went back to the doctor, and they're like, well...
I went to the hospital. They said it was broken. I went to another hospital. They said it wasn't broken.
And then you went to another doctor, and then they said, oh, if you've had compartment syndrome before, you're higher risk for it. So if anything's going wrong, you need to come back.
And what had happened was my GP sent me for an MRI. And when he got the MRI results, it showed very severe cellulitis, so very severe infection, not only in the skin, but the tendons and joints were infected.
Okay, so just to touch on it real quick, and since I'm not your normal co-host for this either, so this is probably just going to be totally annoying, but I'm kind of doing a tally in my head here on how much we've already spent of insurance money.
Yeah.
Right. I mean, not out of pocket, obviously, because you've hit your deductible.
I had a pulmonary embolism.
Thank God you have insurance and you've hit your deductible, right?
Because I had that pulmonary embolism and endocarditis at the beginning of that year. I have a 26 grand deductible. It knocked that out. 3-day hospital stay will knock 26 grand right off.
Okay, which is effing ridiculous. But if you're thinking about it, you're bouncing around between.
I went to two hospitals. I went to two doctors. I had an MRI and two X-rays.
And the only thing that's been done up to this point is your arm's been bandaged and put in a sling.
Yeah, they put it in a sock and tied me to an IV pole.
No. We're not even up to that part yet.
Yeah, no, they made me a brace. That's the only thing that's happened.
So we're talking about this astronomical amount of money, and this is one of the reasons that I think healthcare is fucking failing in the way it is now. Because, say you, I don't even know how to word it because it's so ridiculous, but they're just bankrolling money from the insurance company. There's no reason that the hospital would make any of their prices reasonable, because by just bouncing you around three hospitals and doing nothing, they're just making money. So
3 hospitals is the amount of hospitals I went to.
They're basically incentivizing the fact that they're like, okay, how long can we bounce her around before this is serious enough that we have to fix it? And I'm not saying that they were necessarily doing that on purpose, but I'm just saying, what's to stop them from doing that?
Oh yeah,
and our healthcare system sure as F isn't. And so it's just ridiculous that you're having to do all the legwork with these doctors to get.
I did a pretty smart thing this time. When I had my MRI, I got a CD of it. And then I took it to every doctor I saw after that. Right. If you ever get imaging studies, take it home with you.
Yeah, get the CD. Oh, my God.
If you have CBCs.
That's just because it's cool to watch.
If you have blood work, take it with you. Make a file.
Yeah, that's something I never thought about until I met you, is like what I should really be doing is just making my own medical file that I take with me, Roadhouse style. Because he does that in Roadhouse. He's like, hey, here's my medical history.
And Harris actually has a thing they do where they send you, they call it the Vial of Life, where they send you your medical history home in a packet. So now I have it printed out in a packet.
He's going to a safe place. Well,
I'm pretty sure I already
also,
lost it.
Harris is supposed to actually just share that stuff with other hospitals and doctors over the magical thing we call the internet, but none of that happened.
Even I signed consent.
It didn't even happen between 2 Texas health facilities.
Yeah.
Because Harris.
Oh, no, the problem is Hughley is half still Hughley and it's half Harris.
It's a muggle. It's a muggle.
Oh, I don't like Hughley either, hon. It's a trash hospital. I was there one day and I was really sick and I'm waiting to get seen at Hughley. I think it was the leg infection when I had to have the surgery. And this girl came in, went to the counter, and I don't know her story. Maybe she was a frequent flyer. Maybe they were done with her bullshit. I don't know. But she falls out in front of the counter. She passes out. I don't know if she passed out for real or she passed out for fake, but she hit the ground hard. And they laughed at her. The people behind the counter laughed at her. They came out with the stretcher, and I was an EMT. The first thing they teach you is don't grab the stretcher by the Velcro. They grab the stretcher by the Velcro. They drop her. So I stood up and I walked out, and my mom was a nurse for 30 years. She called the head of the nursing department there and just screamed at her. Politely. But she was like, this can't be going on.
Yeah.
This is ridiculous. I don't care if she's a frequent flyer. Treat her with some respect.
Frequent flyer?
I'm technically a frequent flyer.
Yeah. You're in the damn hospital all the time. It doesn't necessarily make you a drug seeker. That's the thing, is frequent flyer does not always equal drug seeker.
Well, not all frequent flyers are drug seekers. They fall into a couple of different categories. Homeless people are often frequent flyers.
They need a place to stay for the night.
They need a meal.
Yeah.
At JPS, we'd give them clothes out of our donations closet.
Yeah.
And we had a really good tolerance for them at JPS. Sometimes, if we thought it was just food and clothes they wanted, we'd just give them that. And they'd eat it at the desk and they'd leave. Or
just send them to the cafeteria or whatever with a free meal or something.
And then you get your junkies. And then you get your people that want attention. Your hypochondriacs, your Munchausen's people.
Those people you just give enemas.
And then you get your people that are elderly and probably lonely. Those are the 4 types of frequent flyers you get. Of course, the 5th kind is chronically ill people.
Right.
Because by definition, you're chronically ill. You have to go to the doctor a lot. And if you get sick on a weekend or at night, you basically, or if you don't have insurance, the hospital is your only option.
Half the time, the hospital is your only freaking option anyway. Because there's just like the doctors, like you can't just drop in at the doctor's. You have to make an appointment.
And if you do walk in, you're going to be waiting 4 hours.
Right, and if it's something serious enough that you need to go, then you probably need to go to the emergency room.
And even if you have insurance,
blown off anyway.
Before my deductibles met, it cost me $100 per doctor's appointment. If I don't have $100, I can't go to the doctor.
Yeah, that's the difference between going to a hospital and going to the. If you go to the doctor's office, you're probably going to get looked at a little bit better, diagnosed a little bit better. They're going to take their time with you more, but you're going to have to pay some money up front
before you get seen.
If you don't have that money in hand, out of pocket right there, your only choice is the hospital, because at least at the hospital you're going to fill out some paperwork. They're going to send you a big ass ridiculous bill afterwards.
Well, and this causes a multitude of other problems. It overtaxes the ER system. It I mean, yeah, people use it as a clinic. A lot of times they've got nowhere else to go, and it overtaxes the ER system. People who really need help aren't getting it. It's making the nurses and doctors jaded. It's burning them out. But, and I'm sure they understand logically, these people have nowhere else to go.
You know, her comment about people using the ER as a clinic, I'm actually guilty of that once. And
I've gone for ear infections because I had no insurance.
I went for strep throat once because of the one time, like I had missed so much work or whatever, and they were threatening to, Victor was threatening to fire me if I missed any more work. And I owed Texas Health money. I owed them like $500 just from a doctor.
Like, if anyone ever watches this that isn't from around here, Texas Health or Baylor, those are the only 2 games in town.
Yeah, it's basically a monopoly on the health system down here. But my situation is I had just went to a normal doctor's appointment. Now I have had and have medical insurance, but the deductible is I have better health insurance now, but at the time my deductible was like $6,000. So anything I did that was like routine, like going to the doctor or anything like that, it's all out of pocket till you hit $6,000. So it's basically just insurance for like if you get your arm cut off and it costs $25,000.
That insurance is for people like me who wind up with 10. I've spent 3 weeks in the hospital this year.
Right. So I had, like an idiot, gone to the doctor for something like a month before, and then they sent me a bill for $500 and I just hadn't paid it yet. So for strep throat, like my option wasn't to go to Texas Health because the clinic I normally go to, because if you owe them money, they'll tell you to go to the hospital. And it was like 3 a.m. anyway, and I was really afraid about missing work the next day. So I went up to I went to JPS is what I did. Well, I didn't know any better. And I was just like, okay, this is where.
And JPS is a great hospital. Don't get me wrong. I volunteered there for 5 years. My mom was a nurse there for 30 years.
But they are They're overrun constantly.
They deal with the entire homeless population of that area on Allen.
Yeah. Well, in my head,
and are they still a level 1? Because what makes you a level 1 trauma center is you have to have a neurosurgeon and a heart surgeon on call at all times.
No. They have the best. They have the best trauma.
Level 1 trauma centers in Fort Worth.
Yeah, they have. They're
and
the best
Parkland
place to go
Dallas.
for trauma. Actually, everything else.
Oh yeah,
it's
we saw the
crapshoot.
nuttiest traumas there. I loved it.
But I went there because that's the only place I knew to go. Like if you didn't have insurance, and I knew I wasn't going to be able to claim it.
They also have a lot of plans for people who can't afford it. That's the other good thing about JPS.
The good thing that happened is I was like, yeah, I got strep throat, and they're like, all right, well, we don't really want to deal with this, and they gave me the shot or whatever. They cleared strep throat up in like 12 hours. So by the time I was out of the hospital and on my way to work or whatever, I didn't have strep throat anymore. But Victor, he was like, go home and because I had been blowing up his phone all night.
And Catherine made another good point here. There's a difference between going because you have a flu virus. And I think a lot of people, and this drives me nuts, when I worked in the medical profession, antibiotics don't cure viruses.
No.
And doctors will give them to people just to shut
them
them up.
And
Because
that's
what are you going to
actually-
do for this? Now,
That's
if you
making
have
it worse.
if you have the flu or you have a virus and you're not keeping down fluids, if you are dehydrated, that you might need to go to the
Yeah,
ER.
there's
and
reason.
get-
There's reason to go if you need to be monitored or checked or
But
something
if you've
like
got
that.
a cold and it's a virus, you have no business. Why even go to the doctor? Just to clarify what it is, I guess, to make sure it is a virus and not a bacteria you
Well,
can
people
treat.
go in and they're like, oh, I want antibiotic, I want this, I want that.
That's why I've got just a bookshelf full of antibiotics that I'm like, someone doesn't have insurance here. Here's my pharmacy, which is probably super illegal now that I say that.
Yeah, maybe you shouldn't do that on social media.
I don't care.
We flushed all those. They're not real antibiotics. They're actually, I still had some leftover antibiotics on my shelf. I actually got rid of them the other day because they were expired.
Most of mine were too, but you're see, and the other problem is people take antibiotics and they only take like half their dose.
That's not how I ended up with my.
Take every pill. Take every pill. You're creating super viruses. We're all gonna die.
I ended up with mine. I was sick. I was sick with a virus, and the doctor prescribed them for me anyway. Even though I didn't even ask for them. Mm-hmm. But I think he was just in the habit of doing it. I just ended up not taking them because I know I'm like
they've tried to give them to my kids so many times, and I'm like, no.
Yeah.
Rachel said you go for asthma a lot. Yeah, my mom has asthma, and it would be interesting because she'd be at work and they'd have to give her a breathing treatment while she was working. And yeah, the little side ERs are good for a lot of things.
Yeah, I love seeing those pop up. There's one right off of Chisholm when I'm driving back. It's just like a little mini ER thing.
Yeah,
or
like
whatever.
my mom-
and they actually treat you really good in those places.
My mom worked at that one in Joshua, and I used to go there a lot. The problem with those is, like, I went when I was vomiting blood, is if you have anything serious, they do have to send you somewhere else.
Right, because they don't have the way to deal with it.
But at least then you're not bogging down an ER that's seen.
Well, and the good thing about
stuff.
those clinics is a bunch of those are becoming privatized, where instead of going through your say like you have insurance but the deductible's $6,000, they'll put you on some like special payment plans or group plans, and they'll do some stuff for free or whatever. Like they have their own thing, and you can also the one that's off of Chisholm Trail, you can pay in monthly there, like a membership or whatever. So when you go in, everything that they can do there, medications and everything, it's all covered. So it's like a mini health plan that you pay for, and what it is everybody that's got it all goes into a pool. So it's like socialized medicine for that building. Now, like you said, if there's something serious, you're fucked. You know.
Because I went to that Baylor like little side ER twice when I was vomiting blood, and I eventually ended up in Baylor downtown, which was the worst experience.
It's weird that you had such a horrible experience at Baylor, because the one time I've been to Baylor was one of the better places for me. I hate Harris.
They sent me home with my H&H, my hematocrit and hemoglobin, the blood counts, at like an 8 and 24.
God.
Which is...
I mean, that sounds horrible, and I don't even know what it means.
More than like half my blood volume was gone, and they sent me home. By the time I went home and I continued to puke blood, by the time I got to Walls in Cleburne, which is a trash hospital, so it's really weird, they did so well. My H&H was at like a 7 and 21. I immediately had to have a transfusion. I can't believe they sent me home with my numbers that low, because then you're at risk for so many things when your blood volume is that low. Heart attack, stroke. And you remember how pale I looked. It was just a nightmare. But yeah, this time they ended up sending me to Harris downtown, and
ambulance ride.
Yeah,
on top.
I got an ambulance ride. Yeah,
that's what is that at now? $5,000?
I have no clue.
I'm sure that's super expensive.
I owe $1.2 million in medical bills.
So
I
they
don't
tell
even
you.
Look at me anymore.
So they send you to Harris in Fort Worth because you need emergency surgery. Load you up in an ambulance. Of course, me and Steven and the guys are all here playing D. You were actually
I videoed, played D&D. Sort of. I watched.
Yeah,
doctors kept coming in, so I was like, crap.
Yeah. They rush you down there. You get there. You talk to the doctor. They don't even know why you're there because they don't communicate. And you're like, "Oh, I'm here for surgery," and they're like, "No, you're not here for surgery."
And what went on was the doctor. I saw Dr. Booley. Do you guys think about the opioid epidemic? I will broach the opioid epidemic in just a few minutes because that is a long ass rant. Sorry.
Keep the comments coming though.
Yeah, keep the comments coming
nice.
and keep that question in mind because I will come back to that. So I end up at Harris Downtown. They put me on a floor pretty quick. Well, it's funny because they were giving me pain meds. Interesting enough, I was getting Dilaudid through my IV. The PICC line, the first time they gave it was through my IV. It immediately infiltrated and just all went in my arm. And I was like, oh no, it's the only pain meds I'm going to get for 4 hours. And it just went into my arm and not into my vein. But then they came back in and they put it through the IV. I was like, oh, I thought this was going to be a really long night.
Right.
Because they hate giving me pain meds in the ER because I take them at home. I have chronic pain.
Right.
I've had an ER doctor.
And I've been on more than a couple of fucking hospital visits with you too, just because we hang out so much all the time.
And if Steven watches the kids on weekends, so Brad's kind of my go-to for someone to hang out with at the hospital because he doesn't work weekends.
Right. So, but at Walls, that doctor that actually sent you up to Hughley that one time when I went with you. He was really good. He knew you too.
Yeah.
And he knew you as somebody that took
opiates
all the time. And so
he thought I was in withdrawal.
He asked a lot of very specific questions about was it your appendix? Something was going on. We figured something out and you ended up having to get a surgery that time or whatever. That's when you were up there for like a week. I can't remember why we were there. But, and
the one that saw me when I had the pulmonary embolism was really good because the only thing.
That's what it was. Yeah, we were at Walls and like all the symptoms
he
mirrored.
did not have to do. He could have sent me home. He could have.
Yeah.
He had every right to send me home.
He even pulled me. He's like, I really think this is because of the Percocet, but here's the deal. This also presents is stuff with like pulmonary embolism.
Yeah, my D dimer. If you know anything medically, my D dimer was up. That's a marker for blood clots. My D dimer was
even though high. He was pretty sure it had to do with the opiates.
He still treated me like a human.
Yes, he did really, really.
And in the end, he thought I had a heart murmur too.
What's that doctor's name? Do you?
Dr. Lucas.
Dr. Lucas at Walls is a really good doctor.
Indicative of endocarditis. And at the end of all that, it turned out I had about 7 blood clots in my lungs. I had one in my femoral, in my left leg. And I had a massive strep infection in my bloodstream.
Right. Yeah, that was a huge freaking ordeal. I can't believe I forgot that it was that.
Yeah, because I'd been to the hospital the week before, and they had thought it was mono, which was what I also thought. I also thought it was mono.
Yeah, Epstein-Barr?
Epstein-Barr virus.
Epstein-Barr, yeah.
I have chronic Epstein-Barr.
That was the genius thing I came up with, actually.
But that's really what I thought, because I had been sick for 2 months. And they kept saying, well, why didn't you come in sooner? Why? Because y'all treat me like trash.
Well, because you're chronically ill. Like, how do you know when to go
I'm
in?
I'm sick, yeah. I'm always sick. Are you sick? Yeah.
If you're always at a goddamn 8 or 9 all the time, how do you know when it's enough pain to go in? That's not fair. Oh, man, I got us so off track, though. But
sorry. So, okay,
that was my fault. But
I wound up in Harris. What they did is they wanted the infection out of my hand because my hand has had 2 surgeries on it. I have complex regional pain syndrome in it. It's considered one of the most severe forms of chronic pain, and it spreads.
It's the most severe.
I don't want to say that because it's really hard to rate chronic pain, and there's something called trigeminal neuralgia. It's the nerve
in cluster
migraines. There's some really painful stuff you can get, but CRPS, it basically
but on the scale, when you're looking at it on the poster,
it's a McGill pain scale.
It's very, very up at the top.
It basically feels like someone skinned you, dumped you in salt, and then lit you on fire. It's a very sharp, it's neuropathy pain is what it is. It's very similar to neuropathy.
And you're also the one that pointed out to me that's what House has in his leg.
Yeah, that is what House has in his leg. That's why they treat it with ketamine on the show. On the big D, hydromorphone. Oh, Dilaudid. Yeah. So they put me in traction. Basically, they have my hand hanging. They want my arm above my head. And this is what they did to me after my first surgery. When I had the compartment syndrome, they did the fasciotomy. So I'm stuck in this thing. For 12 hours, I sat at the foot of my bed. No one came to take me to the bathroom. And that was at City View, I think. No one came to take me to the bathroom. No one gave me pain meds. For 12 hours, I sat on that foot of that bed just crying with my door open. Not a nurse stopped by to help me. That was probably the worst day of my life. So my worst fear going into this is that I would end up tied to its IV pole,
Right, and that's
which is the first thing they did. And I was just mad. But his logic was good. He didn't want to do surgery on my hand again, considering all the damage it has.
I think any doctor that doesn't want to admit, you can always tell a doctor from a surgeon, because surgeon usually.
Well, and he's a surgeon, so I thought he'd want to cut, but no, he wanted to do something first.
Yeah, actually, that's pretty unstereotypical of a surgeon. Normally they're like, oh, we can just fix this by cutting it out.
Gbulie is how you spell his name. I went to his office in Mansfield today, and he was really nice. But what the traction did for me is the infection was in my hand, and if you're on my friends list, I've got pictures up.
We can you should post them up on the Strictly Sickly page.
I can, but it moved the infection from where it was located in my hand down my arm. So they were able to they opened me up here instead of in my hand, because
we did the close-ups on the other thing, but let's see if you can. I don't know if you guys.
And if
can
you
see
look
that.
here, this is where my the J port went in, and that was draining fluid in the back of my hand, and you can see the scars from the other surgeries I've had. And hands are super delicate, so they didn't want to repeat that surgery I'd had before, which I back them for that. They'll give you pain meds. You're afraid to go into surgery. What happened with this doctor, and it's part of the reason I liked him, is my mom took him aside before they did surgery, and she said she's been on pain meds for 6 years. She has RA, endometriosis, CRPS. She's got a bunch of chronic pain disease. She's refractory to pain meds. I've got a tolerance. And he actually ordered me extra meds, which is really rare. You've got to find a good doctor. Now, if you see a pain specialist, if you do go in, you need to call your pain doctor first. They need to know what they're putting you on, and you can't take any prescriptions home.
Yeah, you can only take pain meds that they prescribe, that they give to you in the hospital.
Yeah. And even the day after surgery, he came into my room to mess with my arm, basically, and take out all the bandaging and pull out some. I had packing in the back of my hand. He ordered Dilaudid. Not just Dilaudid, but he had them put Dilaudid in my PICC line, and he had them put some in the BP Angry IV machine. So it went in over a course of time, because he knew it was going to hurt when he messed with my arm. And I've never had a doctor take such consideration with my chronic pain.
Right.
It was, oh yeah, the JP, Kath was posting about getting the JP drain pulled. Man, it was like 6 inches into my arm. It felt so gross.
Well, I was just watching Steven clean it the other day, where he's got.
Oh yeah, he was stripping the line.
He's got to like squeegee everything out, and just seeing Sarah Juice fill this like little mini. But she had a pin to her shirt for like 3 or 4 days.
There was some nurse with a safety pin fetish, because it was a floor where a bunch of people had NG tubes, so she was coming around pinning them to an NG tube. If you don't know, it goes into your stomach through your nose. She was pinning them to everyone's shirt. So she just has this one giant safety pin with like 300 safety pins stuck to it. She's like, you get a safety pin, and you get and that's all she did. Her whole shift was just safety pin things. She was hilarious.
Was that one like little short one that came in and couldn't speak English?
No.
She was funny as hell.
For 5 days, I sat with my arm in traction. And the reason they did the surgery on day 5 is it started to streak. And when cellulitis streaks, it's searching for a lymph node to go into.
Right.
So it started streaking here up, and it got about here before they finally, because it was really starting to worry me.
Yeah,
because
that could not only get in there, but it could get in your heart.
Well, it would get in your bloodstream.
Yeah.
And then you're septic, and it's an impossible battle.
So, so what was the actual surgery? So they cut this open.
They did a fasciotomy. They were looking for an abscess to drain, but I didn't have any abscesses.
Now, you had a huge knot in there,
Yes.
though. What did they say the knot ended up being?
It was just my muscle was swollen and everything was swollen.
Did he end up, were you joking? Didn't you say he cut out part of the muscle?
Yes, he cut out a strip of muscle, he cut out a strip of fascia, all to culture.
That's where the surgeon thing comes in. He's like, man, I'm already in here.
Well, it was so funny what he told me before surgery. He's like, man, nothing's worse than doing a surgery, getting in there, and there's nothing to do. That's boring. He's like, I really hope there's something cool in there. And when he didn't find anything in my arm, an abscess to culture, that's when he did he did another minor fasciotomy here, and he went through one of my pre-existing scars, which was nice of him.
So you've got other knots coming up. They're thinking it's a ganglion.
They think it might be a ganglion cyst. It also might just be remaining from the infection.
You brought up a good point. Like I had a ganglion cyst on my foot once, and for me, I'm just normal. So they just took the little, like the hammer they use on the reflex hammer or whatever, and just whacked it a couple of times, and it went away in a couple of days.
But my hand has CRPS. Because
So
my
you
mom
can't
was
do
like,
that.
what we used to do back in the 80s when I was a nurse is we take a copy of Grey's Anatomy and we just... I'm like, that's just good medical treatment.
Absolutely.
That's excellent.
But that's risky. Like, you can't do it that way with you. So what did he say to do?
He said to massage it. I'm supposed to, because I keloid really bad, I'm supposed to massage my scars with coconut oil, lanolin, vitamin E, yeah, whatever.
This is
And-
good information for anybody that,
Yeah.
has-
And also the scars I have, because they're through to the muscle and they involve tendons, they lock. So
Right.
if I don't do PT every day, my hand locks down.
So you have to do stretches too and all that stuff, right?
Hold on. I want to read this comment by Michelle.
Yeah, I was going to say, she's one, you said you were going to go
Oh,
back
the
to the
opiate thing. Okay.
opioid crisis.
I don't think there's an opioid crisis. I don't think that's a thing.
Okay, address this. This one looks
I'm
serious.
trying to find a pain management doctor. I currently see an internal medicine doctor for my medications. Now I've been with him for 7 years. When I tried to call and set an appointment for pain management, they tell me I have to be totally clean off my medication. I don't understand that. I know you're not a doctor, but I think it's BS. Okay, so I don't know where you live. First off,
Yeah, okay, so yeah, we're in Texas,
Yeah,
and
I
the,
live
the
in-
laws are different by state.
I
but-
live in Cleburne, Texas. And the way
and if you don't want to post that up, like maybe you could PM one of us or something to let us know what state you're in, and then we might be able to help do some research or something. Because that's part of your
I want
that's
to.
part of your
This is
shtick.
part of the stick here is that I want to help people sort this out because I've been doing this with no help for years. Silicone and compression. I guess I'll ask. I see him again in a week, so I'm going to ask about that because.
Oh yeah, Catherine does have a similar.
They used that
scar
on
nerve.
where they did the carpal tunnel release. They had this putty they put over it that's solidified, and then they wrapped it, and that actually helped keep the keloid from coming up. Catherine, do you want to message me and tell me if there's a way I can get that just online? That would be great.
Also, Catherine's a nurse, guys. Anybody that's in the
She's
the
smarter
chat
than
thing,
me,
yeah,
so she should probably be on
she's
the
also-
show.
yeah. We actually, that's good. You should have her.
Oh yeah,
on.
you should be on an episode.
I'm gonna get you roped in, Catherine, and you can come on with your husky voice.
But Michelle, I wasn't on pain meds when I first went to see a pain doctor. But I know when I switched from one pain doctor to the other, they didn't make me have to be clean. I don't understand why the internal medicine doctor can't call and tell them the situation, why you can't get documentation saying you've been on these meds. Atlanta, Georgia. Okay. I'm
Well,
not
it's-
sure what the
it's-
rules are there.
We can look them up.
I'll
this
look
week.
it up. But and honestly, opiates only have
Really,
to,
that sounds like the same thing we're talking about: lack of communication
Yes.
between different medical facilities and
and
stuff.
I understand you have to be your own advocate, but at some point it gets to be so much work you
Right.
can't do it on your own. And some things, if
Well,
doctors,
that's a lot of times why I go to the hospital with you and say you just need another voice, somebody there to.
Oh,
back
I'm a
you up.
doormat.
Yeah. Well, for
I had
yourself.
I had an ER doctor try and DC my home pain meds because he thought I was too young to be on pain meds.
He illegally took them out of your bag. 'cause
They
he
went through
saw
my
them.
bag and took them. Yes,
That is illegal. They're not. Yeah.
I was going to Dragon Con. He didn't want to let me leave the hospital, and I didn't leave AMA. I didn't leave against medical advice, but I told him I was going home. Thanks for looking that up, Catherine.
So the opioid crisis, the
I-
opioid epidemic.
Okay, I think they're lumping in people who use them for medical reasons with junkies.
You think? No,
know.
they are. We
And
absolutely know they
I
are.
have no issues with junkies. If you know my history, I'm an addict. When I was 18, I had a problem with methamphetamine, so whatever. I think there needs to be more open talking about this because people don't, and that's where you get screwed. So I'm an addict. Which, you know, I hope my pain doctor never sees this, because if you tell a pain doctor that, they won't help you. They think because you were an addict, you are an addict, that you should never get pain.
I might have to scrub the video. We might have to find more creative ways to talk about some of that stuff.
I sincerely doubt that. Man, if they bust me for something like that, I'm going to sue.
You gotta be careful what you say on social media, so let's not say that again on this episode.
Anyway, I don't think there's an opiate crisis. I have nothing against drug addicts. I think they need more understanding, more treatment. I think that this rule they were trying to pass where 3 strikes and you don't get Narcan anymore is BS. They're just going to let you die. That's insane.
I think there's some factors here that are just total garbage, and this is coming. I don't take any kind of pain med. Like my like I said, I'm not normally one of the hosts on this show, but I do have I have mental health problems. That's my episode. But I don't take opiates at all, and I totally know where you're coming, because I see it firsthand. But the thing is so the big thing they want to cite is the amount of people that are dying from opioids, which
but they're lumping junkies, drug
they're
addicts in
lumping
with
people that take fucking heroin and
illicit fentanyl.
And people
They commit suicide.
And
accidental. If you're on fentanyl patches, it is really easy to forget to take an old one off and put a new one on, especially if the patient is elderly.
Or your prince.
Or your prince. Or if it's a little kid. Little kids are on fentanyl quite often if they have cancer. It's a drug they use for kids because you can stick it in the middle of their back. They can't reach it.
So if you take any of those categories and you lump them, they come up with this like astronomical number of people that are dying from it, and that's not fair at all. Because what they're saying the opioid crisis is doctors are overprescribing. Okay, some doctors are
And back in the day,
overprescribing.
they did. I had an ear infection when I was 18. They put me in the hospital with a morphine drip. When I went home, they gave me 90 hydrocodone. I put those in the washing machine on accident. I went back the next day and they gave me 90 more.
God, okay, so, but I'm not saying it doesn't happen. There are, any profession you go out there, you're going to find crooked
And
people.
also, in the beginning, they didn't know what they did. They didn't
Right.
know the rate of addiction.
I don't, okay, so I won't let them get off on ignorance, though. I mean, we know that is total BS, because we know what opium did to people.
And heroin.
I mean, it's not like we were completely ignorant of that. We knew what it did. So, but you're talking about 1 in like 50 doctors doing that. So if they're lumping people that die from fucking heroin overdoses with people that are being the people that are getting heroin aren't getting it from doctors that are overprescribing heroin. They're getting it from a drug dealer that's importing it from Colombia.
And the things
that is not an opioid.
Even if there is an opioid crisis, the people that are paying are the people that have chronic pain. And my pain doctor came into the office a few months ago, and he said, okay, this is the amount of pain meds you're on in milligrams of morphine equivalent. So they do it in MMEs, milligrams of morphine equivalent. So they count up your Percocet, your fentanyl, your hydromorphone, whatever you're on, and they put it in this scale.
Oh, no,
Ultram. They didn't count my Ultram.
Sorry, I'm not a...
And he said, we're going to have to get you down to 90 MMEs a month. Or a day. I forget what it is. So basically, that's half my pain meds gone.
Right.
They pulled the rug out from under me. And he has patients that are on 360 MMEs equivalent.
Right, yeah. Like
I'm low grade on this totem pole.
Yeah, like what they did to you is they cut your stuff in half, and that's pretty bad.
But some people, they cut down to an eighth.
And these are people that are terminally ill, have worse conditions.
He had one guy that got run over by a train, and half of his body is titanium rods and
that's
metal.
nuts. But according to the law, he's only allowed to have 90 MMEs. You guys are all shoehorned
Yeah.
into this one little
And
box.
This rule,
And that's the maximum.
yes, that's the maximum. The minimum, what you're supposed to start them on is 50 MMEs.
Yeah.
Now, I'm on palliative care. I got a disease called gastroparesis. So my stomach doesn't digest food properly. Now, I'm in remission, but it is a terminal disease. So I am technically on palliative care. Which for 2 years has kept me from having to follow these rules, because palliative care patients, because it's considered not end of life care, but you're not going to get better, so we should probably make you comfortable care. I haven't had to follow these rules, but they've taken away that division between palliative
yeah.
care patients and people who will get better.
They just
Another thing that
people
causes
with cancer.
Yeah, it doesn't matter.
It
my grandpa.
it's such bullshit.
My children's great grandpa Art passed away recently. He fell down some stairs, hit his head. He already had very severe Alzheimer's. And he was on hospice, and they were doing morphine under his tongue, the dropper, like with the home health care nurse. He wasn't getting enough, and they wouldn't up it. He would wake up, and he wasn't responsive to anything but pain. He'd just wake up and cry and moan for an hour until he got his meds, which he's going to die in 5 days. Just give him the goddamn drugs.
Yeah, no crap.
It was brutal.
At that point in life, it's like you should be allowed to do heroin if
Yeah.
you want.
Another thing that's fueled this opioid, whatever, crisis, this heroin crisis,
The opioid crisis.
is, stats in the hospital. When you go in and they do your vitals, they made pain a vital. So you do your blood pressure, your heart rate, your pulse ox.
What's your pain at?
Yeah, about a 6. But they made that a vital, and they put it on the little surveys you do when you left the hospital. So hospitals started overdoing pain meds, because then
They wanted it to show improvement by the time they left
then
the hospital.
patients could rail on them for not giving pain meds, and that means junkies too. People that weren't really sick ended up getting pain meds because it became part of the nurse's survey, their record. It's not right. But the problem is the people that are paying aren't drug addicts. And drug addicts, not that they don't get the help they need anyway. They send them to jail instead of somewhere where they can get help. The people that are paying for this are people that were legitimately sick. They're people that are in pain. And Jeff Sessions, with his boner against weed, also has a problem with opiates. And what he did recently was he halved the manufacture of all opiates in the country. And overnight, every hospital had a morphine and Dilaudid shortage. My mom had a knee replacement during this shortage.
Not to mention what that. So that.
And Puerto Rico makes the packaging it all comes in, so we have a shortage of that too.
Yeah, and it also has other impacts outside of the hospital and pharmaceutical too, because now street drugs are super expensive too. Which and you think, like, why is that a negative thing? Why are you saying that? Well, the people that get their stuff on the streets, if they suddenly can't afford it, then that causes a big crime problem too. So that's actually, by making it so that junkies can't get even illegally what they're trying to get, the ones that actually do have a problem, that causes other problems, because they're gonna do other things. So you're gonna have other deaths from
they will
people,
do whatever.
They're like, oh shit, I'm just gonna huff gasoline now, or set myself on fire. I see. The only thing that I see actually happening from our war on opiates specifically,
I can tell you what my pain doctor said.
Suicide rate's going to go through the roof.
This is what my pain doctor sat down and said to me, and he's known me for a long time, and he knows Steven, and he knows I used to be in the medical field. He sat down and he said, I just don't know what to do about this. He said,
that's scary when the doctor looks you dead in the face and is like, he was like, I'm not trying to offend you, but you're going to survive this. But I have patients that are going to kill themselves. He says, I have patients that are going to be driven into the black market. And he said, all over the country, there are patients, the suicide rate's going to spike. The and
black
he's saying
market
that in a way
that's
not blame.
No.
Like, he understands it. And think how bad, like, the pain sucks. I understand that. Think how bad he feels, though, knowing that he's got to go home at night knowing that some of his patients are going to kill themselves in the next month, year, couple of years, something like that. And there's fuck all he can do about it.
One of the ladies in my chronic pain, I'm in a CRPS group. Her doctor, I think in Cleveland, he sees a lot of people with full body CRPS. Like I said, it spreads. And this lady had it in her spine, and they raided her doctor one night because he was prescribing too many MMEs to patients. But of course, he sees the worst off patients in the world.
Yeah, they are the worst of the worst.
People fly there, they move there to see this man because he also has good success rates in treating CRPS.
Right.
They raided his office. None of his patients got their pain meds for that month. She wrote a note that basically said, F you, DEA, this your fault, and shot herself. She had an 11-year-old son. She had CRPS in her spine, and it was...
that would be a horrible place to have it, too. That's just, like, the stability of your whole... Like, I see how bad it is in, like, your hand, arm, and I think it's actually starting to spread
jaw
up
into, my back.
Yeah, your jaw and your upper back, but I couldn't imagine... Well, I mean, I can't even imagine that, but having it at a core spot, like your limb, like is kind of expendable to an extent, but having it in your torso would be freaking horrible.
Well, and if it's in everything connects to your spine. You can't move without using.
If it's in your spine, it's in everything.
And with some people, it moves into their internal organs. It usually starts with your bladder.
God, you're making my tattoo hurt.
But, crap, I was going to say something and now I forgot what it... Talk about something for a second. I gotta think.
Oh, I mean, we were talking about, like, the price of opioids. The prices actually increase significantly because Jeff Sessions cut everything in half.
Oh, the other
in
thing...
the Puerto Rico production of the...
was
packaging.
The DEA. So if you want to dispute something they're doing, so the CDC and DEA came up with these guidelines that they're enforcing.
Not a law.
Not a law. It's a guideline, but they're enforcing it by threatening doctors with taking their license. What are you guys talking about? Disease moving through your body. Complex regional pain syndrome, CRPS. It used to be RSD. Casalia. It's basically your brain. It's very similar to phantom limb pain. It can be caused either either idiopathic, meaning from no known cause, or mine's from an injury. I got compartment syndrome.
Basically the nerves in her hand are still telling her brain that the hand is being damaged,
even though it's not.
Yeah, it's in it. So you crushed your hand.
Yeah.
But your brain constantly thinks your hand is in a state of being crushed,
yeah.
like the act of it happening. So the pain has never left her hand of what it feels like to have your hand crushed. It's
the marker for
happening.
it was I got sick, I had the surgery, I started to get better, and then after I finished with the PT, going to PT and started doing it at home, it got worse and worse and worse and worse and worse. And it got back to the point of, oh, God, this is awful, is when someone finally sent me to a pain doctor, and he immediately diagnosed it. But what I was going to say is the DEA generally allows up to 90 days for you to protest, and you can go to their page and you can protest these guidelines. For this ruling, they only allowed 15 days, and they didn't tell anyone.
Yeah, they threw it under the radar.
Yeah, they put it out when everything else
Jeff
was going
Sessions
on.
Is a slimy dick.
And, so that you only had 15 days to go in, and they make it really complicated for you to protest it, to send in your story.
But this is all directly just to the opioid crisis. Like, I'm against the whole war on drugs
it's all stupid.
In general. It's all about money. It has nothing to do with keeping people off of dangerous drugs. Has nothing to do with that at all.
If you want a war on drugs, educate them early, make rehab more readily available, get better support systems, treat people when they're initially sick.
Well, stop demonizing it. Like, if people are addicts, instead of... Okay, so say I'm an addict and I want to get help. Well, if I have kids, I better not fucking do that. If I have any kind of legitimate illness, I better not do that because I'm going to get penalized for it. I might face criminal charges and things like that. By criminalizing it, you make it so nobody can get better. Like, what country? There's Sweden.
There's a couple countries.
There's a couple of countries that treat it as a disease. If you come forward, you're like, "Hey, I'm an addict. I need help with this." You're not. It's not criminalized. It's okay. We're going to send you to the hospital. We're going to send you to therapy.
We'll help you with things.
Yeah,
and your job is there when you get back. And
maybe not that so much, but it's like you can get medical treatment for it.
A lot of places allow for that too.
And maybe not everybody needs methadone. You know, maybe a lot of people's addictions are psychological, but
a lot of people.
Look at
what
that.
everyone needs is support.
Absolutely.
And addicts get sick too. That's the thing I hate.
Yeah.
Is they see that you are an ever addict and they're like, oh, well, then nothing you say is valid now. You're never in pain now. You can never get medicine now. It's insane.
Yeah.
I've been clean for 10 years.
When we broke your leg, you went in there. They know you're a frequent flyer. Like they're like, you're fine. Like the first time, they're like, it's just a little break or whatever. And
they said it wasn't broken.
Yeah, but it wasn't a thing. Like, she's got a broken leg.
Yeah, I had a broken leg. Basically, they told me to walk it off.
Yeah, but it's all because of how much you've. I mean, you're at like 33 surgeries now.
28.
28. Oh, okay. Did we count it up?
Maybe 29.
We need to keep.
But the first 9
I need
of
to
those,
keep a poster.
The first 9 surgeries I had before I was 9. So
we need to have like a poster of like an outline of a person or whatever, and then we need to like mark on it everywhere you've had a surgery and just keep like a scorecard.
But like I said, I've always been sick. I had 9 surgeries before I hit puberty. It's just sort of insane what they're doing with people with legitimate pain. They're basically saying because some people are addicts, we're okay with you killing yourselves. We're okay with you dying. And I think they really are, because then we're out of the system and not their problem anymore. The Nazis would have called us useless eaters.
Yeah, methadone was just the first thing that came to mind, Kat. But yeah, you're right though. Like, even if you want to treat an addict, like, your options are completely limited here because it's criminalized here. That's the problem. Like, 80% of our incarceration system is full of people
with drug charges.
And a lot of those are trumped up, stupid drug charges. Like, really? We have people serving 20 years in prison for dealing weed, something that's legal in like 5 states now. So, and that's the thing that blows my mind. Okay, so in 5 states, it's legal. In like 3 of them, it's legal recreationally. And there's not this like big like, oh my God, chaos. Like, it works fine. So we've basically admitted to ourselves, on one level, that this isn't really that bad of a thing. But you still have people serving 20. Like, you need to go back and let those people out.
Oh, thank you, Michelle. I'm not sure how strong I am, but surgeries are scary. Like, I don't care how many you have. It's kind of a freaky thing to deal with.
Well, with you, the risk increases every time you have a surgery now. That CRPS will
the CRPS will spread, and it's. I mean, I hadn't had a surgery where I had the inhaled anesthesia in a long time. I'd just been doing Diprivan and Versed, and it's scary when they put the mask on your face and when you pass out.
Yeah, you feel like you're suffocating.
Yeah, you don't like it. It's not fun. But
it's not natural.
Yeah, I can understand being scared of a surgery. I had a bunch as a kid, but the first one I had as an adult scared me because it had been 15 years since I'd had one. As a kid, it was just sort of par for the course. I had one every year.
I would venture to say that actually the most useful thing in getting medical, or what I've observed, the most useful thing for you when trying to get medical care or anything is to have somebody in your corner, like an advocate or somebody to go with you.
And that's something we want to do.
Yeah, I think
we want to have
kind of violates HIPAA. Oh, not really.
It doesn't violate HIPAA. If you choose to bring someone with you, you sign the paper, you put their name on it.
Right.
That's your choice. It's something I'd like to do is set up an advocate, a voluntary advocate plan.
Like a network. Like on the website, it'd be cool if people that wanted to do that for other people, everybody could sign up and say, like, you know, I live in kind of this area or whatever. If you need somebody to go to the doctor with you just to kind of help you talk to the doctor and things like that.
Because I do that for my friends, like with
Yeah.
Allie or Kristen.
Or me.
Yeah, for some reason, if it's one of my friends, I can tell a doctor to shove it. And I can argue with them. But if it's me, I can't do it. And now Allie and Kristen will do the same for me, but they can't do for themselves.
And also, if you have somebody there with you, you can be more self-confident too, because I don't know. I guess it's like a psychological thing. You don't want to look weak in front of.
I don't
people,
want
you
to.
know,
I don't like looking weak at the hospital, so I don't like to act like I'm in pain, which gets me ignored a lot.
Right? Yeah. It's just as detrimental to
My
the
dad
case
says
as-
my dad says I'm too stoic about it.
Yeah.
But also, if I throw a fit, it makes me hurt worse.
Right.
And I think that's the part they're missing is everyone in pain acts differently. Not everyone has to be crying and screaming in pain. Some people react to pain differently. I get real quiet. I kind of space out. My daughter screams her freaking head off. On methadone for pain. Yeah, my mom did methadone for pain control for the last year she was on for her back.
Yeah. Methadone is actually a treatment for CRPS.
It's just, I mean, it's a pain med. It's an opiate.
She has neuropathy in her foot, which is called Morton's neuroma, and they want to do surgery on it. I don't know anything about it.
My recommendation before surgery on anything is just to get the some personal opinions, some stats, see more than one doctor, make sure, because I know a lot of times with back surgery, things don't turn out great. The first back surgery my mom had fixed so much, but then she fell 2 weeks after having it.
Well, God, you and your mom have a lot in common, because just after getting your hand fixed the first time.
I slammed it in a door.
Yeah.
Well, my son did. After I got my nose fixed, I had a deviated septum and a bunch of sinuses. My son was a baby, and he did that baby thing they do where they slam their face into yours, and he just immediately redeviated my septum. Oh, God. I've never wanted to just strangle a baby more. That's a joke, by the way. And then people kept trying to talk to me, like, no, stop, it hurts, don't talk. And no one talk.
You're at about the 4-minute mark from 3-minute now.
From what?
Hitting an hour? How long is this episode supposed to be? Jeez.
Better than taking other medication.
You sure like talking about yourself a lot.
The other thing I think they should do is really legalize marijuana, because while
Yeah.
I've never found it to work for me, it works for a lot
not a
of
magic
other
bullet.
people.
I'm sick of seeing all the articles about it being a magic bullet.
It's not a magic bullet. It won't help everybody, but if they legalized it, you'd have the ability to search for different strains, different types, different methods, different routes of ingestion.
I think it does help a lot of people.
And I had a really good, very frank discussion with my pain doctor about this.
He would even conversate about it, which is
He
good.
used to work in a state where it was legal, and he did his residency at a VA hospital. And he basically said, first off, he told me not to do the CBD oil they sell here, because he said about 5 to 10% of people test positive with the CBD oil for THC, because it's not as regulated as it should be. So he recommended I don't do that, because if I do test positive for THC,
You screw everything
I'm
up.
red flagged. I can't get any more pain meds. But he basically said you gotta. He thinks the THC more than the CBD. Like, he thinks that's what
He
helps
said you
the
have
pain.
to smoke it.
Well,
for it
he
to
said
be,
he just said he doesn't think this. He said you have to smoke it. What I think he really meant was the CBD. I think he thinks the THC has more pain relieving abilities.
right.
I don't know, but
So, you know who wants to end the war on drugs? Beto O'Rourke.
oh yes, Beto O'Rourke. Oh, before we go, I was gonna plug there's a new documentary out called Trial by Fire, and one of the young ladies in it was in my group. She actually passed away after the film was done being recorded. It's a documentary about CRPS and a bunch of people with it. It costs money to rent right now. I'm not sure when it'll be available for free, but they also have a lot of kids that are in it, because CRPS actually affects a lot of kids. And usually that's the idiopathic kind where it has no known cause, and very often it's full body. So imagine a 7-year-old in basically neuropathy pain everywhere 24/7. Most of these kids are admitted to the hospital for the duration of the time they have this. But in kids, luckily, in adults, it's pretty much not curable at all, unless it's the first 6 months after you get it. In kids, they have really good luck treating it and putting them into full remission. But I've heard great things about this documentary. I haven't been able to watch it yet, but I know some people who were in it. So I'd like to plug it because the guy's goal was to show
What's
what it's
it on?
like.
You said is it Amazon?
It was some service that I hadn't seen before.
Trial by Fire?
Yeah,
I'm
it's
pretty
called,
sure
it's,
people can go.
it's called Trial by Fire.
Let me Google it real quick.
Okay.
But let's plug Beto O'Rourke.
Yeah, I'm going to plug Beto O'Rourke. Okay.
Because
I'm liberal. Okay, let's just get that out of the way.
obviously.
But I feel like even if someone is conservative, after experiencing our healthcare system, even if they aren't for socialism, maybe they would be for socialized medicine if they had experienced the way this system works. I think it's one of those things too you have to experience before you understand it. Because I was very against socialized medicine before I got sick. What exactly is CRPS is the question. That's an interesting question because doctors don't even exactly know. It's basically your brain saying you're injured when you're not. Your brain, you get signals from your nerves to your spine. It's your brain saying something is hurt when it isn't. It can also cause swelling, your limb to turn blue or red, temperature differences in hair growth in that limb. The nails will grow faster or slower. Also, you know how you prune in a bathtub? Limbs with nerve damage won't, for some reason. They don't prune. Or they prune differently. I'm not sure what causes that. But
Trial by Fire is on Netflix. Right
is
now.
it?
Yeah.
Oh, I want to watch it. But yeah, it feels... I've never had neuropathy, but my mom has neuropathy from back problems. The way people describe it sounds very similar. It's burny, sharp. It feels like you're on fire. It's tingly. Kind of pins and needles. But generally, the treatments for it are opiates and physical therapy. One of the newer treatments is ketamine. They put you in a coma for 5 days. Basically, it's turning your brain off and back on again. Because the problem is the problem is it rewires your brain. Mm-hmm. And they can't rewire it back. There's no fixing it.
Yeah, people have tried cutting off their limbs.
Yes,
and
amputation.
But the problem is it's not that it's not that your hand is actually
brain.
damaged. It's the sources at your brain. So unless they rewire your brain, it doesn't always fix it. Now sometimes amputation does work, but that's in cases where it's not.
Like I know a guy that had it in his finger. And they cut it off here, and it worked.
Right.
It seems like when they cut it off closer to the spot with the CRPS, it doesn't work.
Right.
The other problem is, like I said, it's related to phantom limb pain.
Right.
So just because they cut it off doesn't mean it still ain't gonna hurt. Now they still use amputation in cases of CRPS because it causes bone degradation, which can cause infections and such. So they still do amputate for CRPS, just not as often.
Yeah. But anyway, October 22nd is when early voting opens up.
And I'm hoping that if we get enough Democrats sitting in Texas, they'll expand Medicaid.
So, what I saw was really interesting is that even though Texas is ranked 50th in voter turnout,
it was 46th last time I checked.
It's 50th. We are currently 50th in voter turnout, but current stats are showing that there's a 46% spike in voter registration right now in Texas, which is a good thing because that means it's usually young people, and young people are usually liberal. I'm actually realistically more bipartisan than I am
Yeah.
Democrat.
I very much believe that being too far one way or the other is not the way to go, that
Right.
we need a middle ground. The problem is the right is so far right that the middle ground looks liberal.
Yeah. But the good thing about O'Rourke is he is really for reform for ACA, not
replace and repeal.
not replace and repeal. Which so if I had my choice, I don't even like the ACA that much because it's got so many problems. I would rather have some kind of socialized medicine. Like, I'm all the way there. But here's the deal, on that topic, like, I don't think, like, if the president came out tomorrow and said, hey, we're doing socialized healthcare, even though I'm for socialized healthcare, I think that'd be a mistake if you just try to flip a switch and turn it on.
Yeah, you can't pull the rug out from under
Well,
it.
so what that's going to end up doing is that's going to basically just eliminate a couple of million jobs, because you got to think of all the people that are working in the insurance, and they're not all like insurance industry is evil, medical industry is kind of evil.
Medicare billing.
Yeah,
like, she does medical billing.
But there's normal people that have job. I think the CEOs, fuck them.
Yeah.
But
But
there's
the people that do the billing and the paperwork.
yeah.
and
All
that.
of a sudden, that's a lot of people out of work. So you can't just flip on socialized medicine that way without finding a way to transition that and have jobs for those people. So I believe that the correct avenue is fixing the ACA so that we can slowly transition to a socialized thing, or something that somehow makes insurance work and actually be affordable, right? And that's in Beto likes socialized medicine. He's even talking about maybe doing it on a state level.
And Cruz is the Zodiac killer.
But I think But what I like about Beto is, even though he's initially like kind of for flipping that switch, he's the kind of person where he works across party lines.
Yeah, he has a good history of working across party
even though
lines.
that's kind of his want, I think when he gets in there and they're like, okay, well, that's a bad idea, and he talks to people, and because he listens is what I really like about him. And we say, okay, let's take these steps. He'll be like, oh yeah, that's great. Let's take steps.
Yeah.
So I really like him because he wants to get rid of the war on drugs. He's very upfront about there is not a freaking opioid epidemic. He's like, there are people that have problems and those people need help. But I
hate that everybody's just on this opioid epidemic.
It's a freaking.
Railing.
It's just a damn smoke screen for money. And the really funny thing is the new drug that they're testing, that the FDA just approved to help with opioid dependency, is produced by the same companies that create the opioids.
Honestly, except for the fact that they're the ones making money off of it, I don't see a problem with that.
They shouldn't be allowed to make money off of it. If they were so righteous, or
who better to cure the poison than the person that made it?
That's true, but if they were being altruistic, it wouldn't be for money. It'd be like, okay, well, we're providing this to the public for.
And what they created isn't new. It's a time release form of buprofen.
Yeah,
it's an addiction drug that's been around forever. It's just a time release form. But anyway, Michelle said she deals with PTSD. I think even if you don't have mental health care problems before you get chronically ill, you get them after. Because I had depression before.
Yeah,
and it makes it so much worse.
And you're planning on doing a whole episode on mental
health?
Yeah, because I do have PTSD.
I think maybe the next episode will be mental health issues. And
well,
Michelle,
I hope I was a good co-host.
You were. And Michelle, I should say, every doctor tries to pull you off your pain meds. That's what they all do. But you. I mean, if you need them, you need them.
Find you an advocate, or some kind of outlet to help you deal with this crap. Because I think the worst thing about the whole situation is people are just left to deal with this shit on their own, and it's totally horrible. And we're in a not fair situation that's being controlled by a bunch of politicians that don't have to deal with these everyday problems. And it's why should somebody get to have a say in how much pain medication that a chronic pain patient gets?
And that's what I said is I
You
don't.
need to wrap up. You're getting
I'm
too
gonna
long.
wrap up. I say I don't wish this disease on anybody permanently, but I wish it on them for one day. And anyone who anyone who watched, you can always message me on Facebook or through the Strictly Sickly Facebook whatever page, and I can talk to you about this. I can look up stuff, and like I said, I want to arrange for advocates to help people deal with this, but it's going to take a lot of time.
Well, so once I get the Strictly Sickly site up for it, 'cause that's what I do. I do producer stuff. Once I get that up, I can form like a sign up sheet sort
Okay.
of thing where people can, maybe not put their full names and numbers in like a bunch of personal stuff, but maybe they can put like an approximate location. And they'll be able to like input how many miles from their so
And then it will be their own responsibility to contact each other.
like a zone, and they'll have like a screen name. So if you go and type into the database like your zip code and it comes up, it'll bring up like a list of people by their screen names or whatever, and you can click and you can PM them.
Yeah.
Right, and you won't have any of their personal info or whatever, but you guys can work something out from there, and maybe that'll be helpful.
Okay, well, thanks for watching, y'all. I appreciate it. And remember, message me if you need anything.
And if you like paranormal stuff, you should check out our other.
Yes, NT Paranormal, because I ghost hunt as a hobby.
God, we have like 4 podcasts at this point now.
I have 3.
You control the world. All right, thanks for having me, Sarah. I'll be
was
back
fun.
to talk about all the creepy crawlies that happen in my head.
And we have no schedule for this podcast yet, so I'll try and get a date for when the next one's going to come out. But since everyone has chronic health issues, it's kind of hard to stick to a schedule.
That's the irony of it. Every time you go to do a podcast, well, so and so couldn't make it. They're in the
sick.
hospital. All right.
Later, y'all.